In this video, we'll discuss about the interceptive orthodontics. Now, what is interceptive orthodontics? It is a phase of art and science of orthodontics employed to recognize and eliminate potential irregularities and malposition of the developing dentofacial structures. All right. So basically, it comes before. Yes. So basically, it comes after preventive orthodontics. What is the correct meaning is basically what you're referring to is if there is any potential irregularity or deviation from the normal occlusion. So in this phase, we are basically going to recognize it and eliminate it so that it does not develop into a further malocclusion of the dentofacial structures. All right. Now coming on to the procedures that come under interceptive orthodontics. What all can be employed? So the first one is the serial extractions. This is a very important topic, and I'll discuss it in another video in full length, but you have to mention it here too. Then it is the elimination of soft tissue or bony barrier to enable a eruption of teeth. Then correction of developing crossbite, interception of habits, muscle exercises, space regainers. This is also very important. I'll discuss it in another video. And then one is left, interception of skeletal malrelation. All right. Now, serial extraction, we'll discuss in another video. So, coming on to the interception of the habits. Or we can start with the second one. Yeah, let's start with the second one, which is the elimination of the soft tissue and the bony barrier to enable the eruption of the tooth. So, basically, in this, what we do is we employ surgical procedures and we make sure that the permanent tooth, which is failing to erupt on the appropriate time, we stimulate the eruption by surgically exposing the crown. All right. So, a permanent crown that fails to erupt on its appropriate time, eruption is stimulated by surgically exposing the crown. All right. Now over here, this is mainly this can be due to any supernumerary teeth present, or it can be due to over retained primary teeth, or it can be due to ankylosed teeth. First of all, these need to be ruled out, and then we can carry on with this procedure. All right. Then in surgical procedure also, what is involved is the removal of any bone, excision of the soft tissue. Now the extent of soft tissue removal is till the greatest diameter of crown of tooth is exposed. All right. Then the surgical wound is given a cement dressing and it heals in a period of 2 weeks. All right. Now we are done with the elimination of the soft tissue. Now correction of the developing crossbite. So basically, I have made a video on crossbite as well. So what is crossbite? It is basically a reverse overjet. So reverse overjet. Now it mainly is seen when the maxillary teeth. Now, usually the maxillary teeth are present labially to the mandibular teeth, all right. But in crossbite, what you will see is the maxillary teeth, they lie lingually or palatally in relation to the mandibular teeth. In layman terms, if I have to explain you crossbite, so I would say that the maxillary teeth or the tooth is lying lingual towards the tongue side and the mandibular tooth is covering it. So basically something like this is the maxillary and this is the mandibular. Usually what we see is this relation. All right. Yeah. So but in what yeah, I'll just draw it. Suppose this is the, oh my god, that's a pathetic drawing. Suppose what we have is, suppose we have, this is our maxillary teeth. Yeah. So what you see is usually it is like this. This is the mandibular. But in crossbite, what happens is you will see that this is the, okay. But what happens is, yeah, this is the mandibular teeth and this is the maxillary teeth. So it is behind the mandibular, all right? So this is crossbite. Now, a very important phrase to remember. As soon as you see crossbite, treat it as soon as possible. Now, why is it so? As soon as possible, because what we will see is crossbite has the higher chances that it will come up in the mixed dentition also, and it will show in the permanent dentition also if it is present in the primary dentition. Then second is it can lead to skeletal malrelation as well. Now the treatment. Now if it is a single tooth crossbite, so single tooth crossbite can be treated with a tongue blade, Catalan's appliance, or double cantilever spring. Now, sometimes it can either be due to a pseudo class 3 malocclusion. In this, what you need to know is, what is pseudo class 3 malocclusion? First of all, we know that class 3 malocclusion, the maxilla is retrognathic and the mandible is prognathic. All right. But in this, what happens is the patient, he habitually closes the mandible by placing it forward. So basically, there is a shift, there's a functional shift in the centric relation and the centric occlusion of the patient. So this needs to be treated. So this can either be treated by surgery or through exercises. All right. And the third one could be the dentoalveolar. Now, if it is due to dentoalveolar, either the mandible and the maxilla is going to be retrognathic and the mandible, basically true class 3 malocclusion. All right. Now, in true class 3 malocclusion, what you will see is the mandible, it is prognathic and the maxilla is retrognathic. All right. So basically, we have to treat it if the maxilla is retrognathic. So we give headgear. Now, if mandible is prognathic, we give chin cup or chin cap. If it is both, then we will give a reverse pull headgear plus a chin cap therapy. All right. Over here, basically, you need to eliminate the occlusal prematurities. I have already made a video of treatment of the crossbite both anterior and posterior. You can refer to it as well. Then the third one is the interception of habits. Now, what are habits? According to orthodontics, basically in orthodontics, what we see is habit. It is a sense of action. It is basically certain action involving teeth and oral and perioral structures which are repeated often enough by patient to have deleterious effect on position of teeth and occlusion. All right. Now we will talk about three habits. The first one being the thumb sucking, then mouth breathing, and then tongue thrusting. All right. Now thumb sucking. Now usually in age of 2.5 to 3 years, it is normal for a child to perform thumb sucking. But if the child performs thumb sucking from 3.5 to 4 years or even beyond that, it is abnormal. And we will have to do some psychological counseling and we will have to give some habit breaking medicines, bandages. I'll be discussing it under a video of interception of habits, so you can refer it from there. Then tongue thrust. Now, this can only be intercepted by using habit breakers, because what you will see is there can be an open bite. Due to this, there can be anterior proclination that has to be corrected. All right. Then mouth breathing. Now mouth breathing is also of, I think, three types. The first one is the anatomic, then is the obstructive, then is the habitual. Now obstructive and habitual. In obstructive, either it can be due to the deviation of the nasal septum, or it can be due to the nasal polyps or tumor or any nasal obstruction. Habitual is when the patient is habitual to mouth breathing. Now, in this, what we see is in this there is a lowered mandibular and tongue posture because of mouth breathing. Lowered mandibular and tongue posture. Because of this, the orofacial equilibrium is affected. Now, this can be corrected using a vestibular screen. Thumb sucking by cribs, by rakes. All right. Tongue thrusting. I'll talk about it later. So this is done, then we have the muscle exercises. Very important. It was introduced by JP Rogers. Now in muscle exercises, we will talk about the masseter muscle first. So basically in this, what happens is clenching of the teeth by patient while counting to 10. All right, then the second is asked to repeat for some duration. Yeah. Then the second one is by the lips, so circumoral muscles basically. Now in this, what we do is we ask the patient to stretch the upper lip. It is important to maintain the lip seal. Basically, in patients who have the hypotonic lip, short hypotonic lip. Also, the patient is asked to stretch upper lip in downward direction towards chin. Then second, hold and pump water back and forth behind lips. Then massage of lips. Then button pull exercise. In this, what we do is we take a button of 1.5-inch diameter. The thread is passed around the buttonhole. Thread is passed around buttonhole. Patient is asked to place button behind lips, then pull the thread while restricting it from being pulled out using lip pressure. All right. Then the third one would be the, we can also mention one more exercise here, which is the tug of war exercise. This is very similar to the button pull exercise, but in this we have two buttons and they're placed behind the patient lips and one is held by another. So person is asked to pull the thread. All right. Then tongue. Now in tongue, one is the one elastic swallow. This is for correction of improper positioning of tongue. In this, what we do is we take a 5 by 6 inch intraoral elastic and we place it on tip of tongue. Place it on tip of tongue. Then the patient is asked to raise the tongue and hold the elastic against rugaria and swallow. Then the second is the tongue hold exercise. Similarly, the 5 by 6 inch elastic is taken and it is positioned over the designated spot with lips closed, and the patient is asked to swallow with elastic in position. Then is the hold pull exercise. In hold pull exercise, the tip of the tongue and the midpoint, they are made to contact the palate, and mandibular is gradually opened. This is important. In this, the tip of the tongue and midpoint made to touch palate. This is very often done in prosto also, made to touch palate, and patient is asked to open mandible gradually. Also, one is left, which is to elastic swallow. Now, in this, one is placed over the midline and one is placed over the tip, and then the patient is asked to swallow. All right, then we are done with muscle exercises. Space regainers, we will discuss in a complete video. Interception of skeletal malleolation. Now, this is very important. Basically, we will do myofunctional therapy or the orthopedic therapy, whichever is possible. So, basically, we will concentrate on myofunctional appliances because there is growth potential and we have to intercept it. All right, now, basically, surgical is in the corrective part of orthodontics. All right, now if basically we all know about the skeletal class 2 malocclusion. In skeletal class 2 malocclusion, what we see is there is maxilla, which is prognathic. All right, then second scenario can be mandible, it is retrognathic. Then third case scenario is a combination of 1 and 2. Now if the maxilla is prognathic, all right, we must restrict the growth, so we use headgear. If the mandible is retrognathic, we have to stimulate or we have to promote the mandibular growth, so we will use myofunctional appliances. All right, so myofunctional Combination में headgear plus myofunctional. Now class 3 malocclusion. In class 3 malocclusion, there is again three scenarios. The maxilla, it is retrognathic, opposite of class 2. Then mandible is prognathic. And third scenario can be combination of first and second. Now maxilla is retrognathic, so we have to stimulate the growth of maxilla. How can we do it is through face mask therapy. How can we stimulate the mandibular growth is we have to restrict the mandibular growth because it is already very prognathic, it is very forward. So chin cup, and this is face mask plus chin cup therapy. All right, now we are done with this. I'll make a separate video on the serial extraction as well as the space regainers, very important topics, and they often come as a short note, so that's why I'm making a separate video of them. I hope you liked the video and I made you understand it in an easier and easy to remember way. So thanks. Do subscribe to my channel. Thank you for watching.